A brain tumor is an abnormal growth of cells in the brain. These cells grow and divide uncontrollably, forming a mass. The skull, a rigid structure protecting the brain, leaves no room for expansion. Consequently, this growth causes pressure on the brain, leading to various neurological problems. Brain tumors can be benign or malignant. Benign tumors are non-cancerous and grow slowly. Malignant tumors, on the other hand, are cancerous and can grow rapidly. They can invade surrounding brain tissue and spread to other parts of the body. The impact of a brain tumor depends on its size, location, and growth rate. Some tumors are slow-growing and cause minimal symptoms. Others are aggressive and require immediate medical attention. Understanding brain tumors is crucial for early detection, diagnosis, and treatment. Brain tumors are broadly classified into two main types, primary and secondary. Primary tumors originate in the brain itself. Secondary tumors, also known as metastatic brain tumors, begin in another part of the body and spread to the brain. Primary brain tumors are further categorized by the type of cell they originate from. The most common type of primary brain tumor in adults is glioblastoma. It arises from glial cells, which support and protect nerve cells. Meningiomas, another common type, develop from the meninges, the membranes surrounding the brain and spinal cord. Secondary brain tumors are more common than primary brain tumors. They most often spread from the lungs, breasts, colon, kidneys, or skin. The type of brain tumor influences treatment decisions and prognosis. Accurate classification helps doctors determine the most effective course of action. Brain tumor symptoms vary greatly depending on the tumor's size, location, and growth rate. Some tumors cause no noticeable symptoms until they are quite large. Others produce symptoms early on. Headaches are among the most common symptoms of brain tumors. These headaches may be different from those you're used to, often more severe in the morning or worsening with coughing or exercise. Other frequent symptoms include seizures, nausea and vomiting, vision problems such as blurred or double vision, gradual weakness or paralysis on one side of the body, difficulty with balance and coordination, speech difficulties, personality changes, and confusion and disorientation. It's crucial to remember that experiencing these symptoms doesn't automatically mean you have a brain tumor. Many other conditions can cause these symptoms. However, it's essential to see a doctor immediately if you experience any of these warning signs. Early detection and diagnosis are crucial for improving treatment outcomes. The exact causes of brain tumors are largely unknown. However, researchers have identified several factors that can increase the risk of developing these tumors. Genetics play a role in some brain tumors. People with certain inherited genetic syndromes, such as neurofibromatosis and tuberous sclerosis, have an increased risk of developing brain tumors. Exposure to ionizing radiation is a known risk factor for brain tumors. This type of radiation is used in medical imaging tests like X-rays and CT scans. However, the amount of radiation used in these tests is generally considered safe. Other potential risk factors include age, as most brain tumors occur in older adults; gender, with men being slightly more likely to develop brain tumors than women; race, as Caucasians have a higher risk of developing brain tumors than other racial groups; head injuries, with some studies suggesting a link between severe head injuries and an increased risk of meningiomas; and cell phone use, though the potential link between cell phone use and brain tumors has been a subject of much research. No conclusive evidence exists to support a causal relationship. While these factors can increase risk, it's important to note that most people exposed to these factors do not develop brain tumors. The development of these tumors is likely a complex interplay of multiple genetic and environmental factors. The diagnostic journey for brain tumors begins with a comprehensive neurological examination. This exam assesses various functions, including mental status, which covers alertness, memory, and language skills. It also evaluates cranial nerves, focusing on eye movement, facial sensation, and hearing. The motor system is assessed for muscle strength, coordination, and reflexes, while the sensory system is checked for touch, pain, and temperature perception. Imaging tests play a crucial role in visualizing the brain and detecting any abnormalities. Magnetic resonance imaging, or MRI, uses a strong magnetic field and radio waves to create detailed images of the brain and spinal cord. Computed tomography, or CT scan, utilizes X-rays to produce cross-sectional images of the brain. Positron emission tomography, or PET scan, employs a small amount of radioactive material to measure glucose metabolism in the brain, often helping to distinguish between benign and malignant tumors. A biopsy, the removal of a small tissue sample for examination under a microscope, provides a definitive diagnosis. This procedure determines the tumor type and grade, guiding treatment decisions. Treating a brain tumor requires a multidisciplinary approach involving a team of specialists. The team may include neurosurgeons, neuro-oncologists, radiation oncologists, neurologists, and other healthcare professionals. The treatment plan depends on several factors, including the tumor type and grade, tumor size and location, and the patient's age and overall health. The primary goals of brain tumor treatment are to remove as much of the tumor as possible, kill any remaining cancer cells, relieve symptoms, and improve quality of life. Surgery is often the first line of treatment for brain tumors. The goal is to remove as much of the tumor as possible without damaging surrounding brain tissue. The extent of surgery depends on the tumor's size, location, and type. There are different types of brain surgery. A craniotomy involves removing a portion of the skull to access the tumor. Transsphenoidal surgery reaches tumors at the base of the skull through the nasal cavity, minimizing disruption to the brain. Brain surgery is a complex procedure with inherent risks and potential complications, including infection, bleeding, seizures, brain swelling, and neurological deficits such as paralysis or speech problems. Chemotherapy and radiation therapy are frequently used to treat brain tumors, either alone or in combination with surgery. Chemotherapy uses drugs to kill cancer cells. These drugs can be administered orally, intravenously, or directly into the cerebrospinal fluid, the fluid surrounding the brain and spinal cord. Radiation therapy uses high-energy rays to damage and kill cancer cells. Types of radiation therapy include external beam radiation, which delivers radiation from a machine outside the body, and stereotactic radiosurgery, which delivers focused beams of radiation to a precise location in the brain. Chemotherapy and radiation therapy can cause side effects, including nausea and vomiting, hair loss, fatigue, and a weakened immune system. Advances in brain tumor treatment offer new hope for patients. Targeted therapy uses drugs that specifically target cancer cells while sparing healthy cells. These therapies focus on specific molecules involved in cancer cell growth and spread. Immunotherapy harnesses the body's immune system to fight cancer. These therapies boost the immune system's ability to recognize and destroy cancer cells. Clinical trials are research studies that test new treatments and therapies. They offer patients access to cutting-edge treatments before they are widely available. Living with a brain tumor can be challenging both for patients and their loved ones. Support groups, counseling, and other resources can help individuals cope with the emotional, physical, and practical challenges of this disease. Support groups provide a safe and supportive environment for patients and families to connect with others who understand what they're going through. Sharing experiences, information, and coping strategies can be invaluable. Counseling can help patients and families process their emotions, manage stress, and develop coping mechanisms. Rehabilitation services can help patients regain lost function and improve their quality of life. These services may include physical therapy to improve strength, coordination, and mobility, occupational therapy to regain skills needed for daily living, and speech therapy to address speech, language, and swallowing difficulties. While brain tumors remain a significant health concern, ongoing research offers hope for better treatments and a brighter future for patients. Scientists are actively investigating new drugs and therapies, improved imaging techniques for earlier detection, genetic markers to identify individuals at risk, and strategies to prevent brain tumor development. Brain tumor research has made significant strides in recent years, leading to new treatments, improved survival rates, and a better understanding of these complex tumors. With continued research and advancements in care, we can look forward to a future where brain tumors are no longer a life-limiting diagnosis.